Hi, everyone. Welcome to our graduate admissions webinar for Penn Nursing. My name is Jamie Eidlin. I am the Associate Director of Graduate Admissions at Penn Nursing. Thank you all for joining us today. It's great to see where everyone is listening in from in the chat. So if you haven't taken a moment to introduce yourself in the chat box, please feel free to do so. A few housekeeping tips before we get started. Please stay muted during the presentation. I understand that life continues to go on. You might have kids or pets or anything else in the background. So I ask that you stay muted. Please save your questions for the end of the presentation. A recording of this presentation will be emailed in a few days. And if we don't get to your question or you have additional questions, please email us at admissions@nursing.upenn.edu. Here's the agenda of what we'll talk about today. We're going to do a very brief overview of our graduate programs, get into application requirements and tips. We'll briefly talk about student services and financial aid, and we'll end with a Q&A. And just a heads up that this webinar won't cover our accelerated nursing programs or our postgraduate APRN programs. And if you have questions about those, again, just email us at admissions@nursing.upenn.edu. So first up, let's talk about our MSN programs. We have a variety of MSN programs. Most of them are for nurse practitioner or advanced practice nursing programs. As you can see on the screen, our programs range from acute and primary care across the lifespan and in several specialties. We also have two administration programs that are non-clinical, that, as the names imply, lead to careers in health leadership and healthcare administration. Our MSN programs can be completed full-time or part-time. Full-time are between 1 and 1.5 years. Most are 1 year, the longest are 1.5 years. Those are the family NP and the nurse midwifery programs, or you can complete them part-time. That is a very popular option. About 2/3 of our students are doing a part-time program, and that would take between 2 and 3 years. All of our programs are on campus in Philadelphia, Pennsylvania. And clinicals are organized by the school, and clinicals take place in Pennsylvania, New Jersey, and Delaware. For those of you not from the area, those states are pretty close together. So New Jersey is only about 20 minutes from Philadelphia. The border of Delaware is only about a half hour from Philly, so they are relatively close. Upon graduation, you are eligible to sit for your program's national certification exam. So you can practice in any state. However, you might have specific state requirements if you do move out of Pennsylvania to practice. Some of you still may be figuring out which program is right for you. Our programs are based off the APRN consensus model, which states the focus of care is based on patient needs, not on the clinical setting. So that means that you're not necessarily restricted to the type of setting you would be working in, but you are restricted to the population and acuity level. So if you are interested in pediatrics, but you're not quite sure what you want. Primary care, you're only working with the pediatric population in a primary care setting. So you would not be seeing adults. You would not be in an ICU. On the flip side, you'd be working with pediatric patients in an acute care setting. So do keep that in mind if you are deciding between populations and acuity levels. This is a very basic outline of our clinical MSN curriculum. Every program starts out with the 3 Ps or the core curriculum: pathophysiology, pharmacology, and physical assessment. Each student has to take a research course for the MSN program. Then you dive into your theory courses on your population or focus. And then lastly, you complete clinical placements. Our administration curriculum varies between the two programs. The health leadership program, the curriculum is a bit more flexible. As you can see, you have more electives. You also take electives at other Penn graduate schools, which is a great opportunity. Many of our students take classes at the law school or the business school, which is a great way to infuse your curriculum with different focus areas. The Nursing and Healthcare Administration program, that curriculum is a bit more rigid. As you can see, there are more required courses. There's also an administrative practicum at the end where you choose an organization and work with a healthcare leader on an existing problem or initiative going on in that organization. We also have some minors available. Most of these minors are only around 3 courses. I will say if you're doing a full-time MSN program, the minors can be a little difficult to complete full-time because most of our programs only have 1 elective or don't have any electives. If you're doing the program part-time, it's a little easier to complete the minor. Some of these are just designed to increase your knowledge in a certain area. Others, such as adult oncology or palliative care, do lead to certification. So at the end of that minor, you are eligible to complete the certification exam in that area. Those with an asterisk next to them can be completed as a standalone postgraduate certificate. So you complete your MSN at Penn or elsewhere, and let's say you want to come back and be certified in adult oncology or nursing education, you can come to Penn and just take those 3 courses. As I said, you can complete the MSN programs full-time or part-time. If you want to do part-time, you can start at any semester. So spring, which is mid-January, summer, which is late May, or fall, which varies between late August and early September. If you are starting full-time, you either start in the summer or the fall, and it does depend on your program. So do keep in mind that programs start specific times for full-time. Our acute care programs require work experience. I realize there's a lot of text on the screen, so don't worry. Again, this presentation is recorded, and this is just pulled directly from our website, so you can always go back to our website. All of our acute care programs require at least 1 year of RN work experience in that area. The neonatal program requires at least 2 years in a level 3 or higher NICU. All work experience should be full-time, calculated after orientation, and that's important because orientation can last a few months and be within the last 3 to 5 years. If you're not quite sure if your work experience would meet our requirements, you can always email us your resume and we'll let you know. Our primary care programs do not require work experience, but competitive applicants typically have at least 1 year of work experience. And across all of our MSN programs, our incoming students have an average of 3.5 years of work experience. So we really do value work experience coming into the programs. And again, just to recap, because I always get questions about this, on the left are the programs where work experience is required, which is our acute care programs. And on the right are the programs where work experience is not required, but preferred, which is our primary care programs and our administration programs. We also have a non-degree option. So let's say you're not quite sure what program you want to attend, or you'd like to take some classes to boost your academic background or get back into the swing of things. We allow prospective applicants to complete up to 2 non-clinical master's courses as a non-degree student. So students usually take pathophysiology and pharmacology. There's a short application, and the deadlines follow the MSN application cycle, which I'll get to at the end of this presentation. Okay, next is our DNP programs. First is our DNP in nurse anesthesia. This is a 3-year program, and it is only offered on a full-time basis. It is on campus in Philadelphia. You can enter with a BSN. You don't need an advanced degree. We are admitting about 2 years in advance. So applicants applying this fall will apply for summer 2023. The 2022 application is closed. We are no longer accepting applications. The next cycle available is summer 2023. So keep that in mind. If you're planning in advance, it's usually about applying 2 years in advance. There is a specific work requirement. You need to have at least 2 years of work experience by the time you matriculate. Again, the work experience needs to be full-time and post-orientation, and it needs to be in an ICU or critical care, working with the most critically ill patients. There are several areas we don't accept, which are the neonatal ICU, emergency room, recovery room, step-down units, and interventional radiology. And as before, work experience is very important here. The average incoming student has 4.5 years of RN work experience. The nurse anesthesia curriculum is fully integrated between your didactic courses, simulations, and clinicals. So a lot of programs will do the first half courses and your last half clinicals. We start you from the beginning. So the program starts in May, and by August, you're in your first clinical. So you dive right in. We also operate on a primary site model, which means, as the name implies, you have a primary site, and that you return to every year or every semester after you rotate through your other required sites and specialty sites. So this allows for students to be mentored and have a home base when you're not rotating. And a lot of times students have such a positive experience that they wind up getting employment at their primary site. We have 2 postmasters DNP programs. The first is just called the postmasters DNP. This expands the skills of master's prepared nurses to translate evidence to improve clinical practice and health outcomes of specific populations. You need to have an MSN or a master's degree in nursing. And our executive leadership DNP is designed for nurses who already have leadership experience with executive level skills to lead systems and organizational change. This requires an MSN or a master's degree in a related field, such as an MBA or an MPH, and 2 years of leadership and fiscal management experience. We are not very prescriptive with the leadership and fiscal management experience. We understand that that can mean a lot of different things for a lot of different people. So for this program or the postmasters DNP, if you're not quite sure which one you qualify for, again, just email us your resume and we can let you know. Both programs are 2 years, part-time, and they are 100% online with a few on-campus intensives when we can meet on campus. And just a heads up, so the programs require an MSN. This must be an advanced degree, such as an APRN degree, administration, education. If the only MSN you have is a direct entry MSN that leads to an RN license, so a degree designed for non-nurses to become nurses, you are ineligible for this program. If you have another MSN, then you are eligible. This is the sample plan of study for the postmasters DNP program. And again, this is on our website. And this is the sample plan of study for the executive leadership DNP program. And the courses in red are where the courses differ from the postmasters DNP. And last but certainly not least is our PhD program. So the goals of the PhD program are to develop you as a scholar and a scientist. This is a research intensive program. This is designed for you to pursue a career in nursing research. One of the driving factors of our admissions decision is fit with faculty. So you are strongly encouraged before you submit an application to reach out to faculty who align with your research interests and you think may be a good mentor during your PhD program. And you can search by research interest on our website. Full-time students are fully funded for the first 4 years, which includes a living stipend and covers tuition fees and health insurance. And this program is on campus. The curriculum includes core courses, including a statistical sequence. One nice thing about the program is that you can complete the statistical sequence at another Penn graduate school. So a lot of times students might be interested in the public health stats courses or at the business school or School of Social Work and Policy. So another great way, again, to explore Penn and explore different academic interests. You have your concentration courses. And then depending on how you're funded, you'll either have a teaching residency or a research residency. And then you complete your milestones, including your dissertation defense. The median time to degree is just under 4 years. So it is certainly possible to complete the program in 4 years, but that depends on your dissertation and research progress. Okay, let's get into the application requirements and some tips. So these are the application requirements for all of our programs. Excuse me, and I'll go over these in detail over the next few slides. So in general, what do we look for? We have a holistic admissions process, which means we are looking at the entire application. Of course, academics or the way your essay is written or recommendations can certainly sway us in one direction or another, but we are looking at all parts of your application equally. There are no extra points or ranking for any part of your application. We look at everything and we weigh everything equally. And we really take into consideration the trajectory of your career, the progress of your academics, how well your essays are written, and do they demonstrate interest in the role, your experience, the strength of your recommendations. We truly look at everything and more than just what's listed on the screen. Start your application early. That is one of my biggest tips. The application has been open since July. Starting it early just allows you to submit a competitive application. Even if you don't plan on submitting until the deadline, which most people do, at least you have an idea of what's going on in the application and what's required of you. We require a resume. We don't have a specific format requirement or length requirement. Most people submit anywhere between a 1 or 2 page resume. Everything on the screen is what you can include, and of course more. Feel free to include anything significant, even if it wasn't part of your nursing career, if you had a previous career, if you had leadership or experiences in other parts of your life. That is part of the holistic admissions process. And we certainly want to see that in your application. Essay questions, the basics. So just make sure they're easy to read, double space, 12-point font. I am reading lots of applications every day, and it goes a long way. It will certainly help my eyes and eyesight in the future if your application is easy to read. Proofread. I know you're thinking, well, of course I do that, but everyone misses something. Your first draft is never your best draft. One spelling mistake or grammatical mistake won't affect your application, but the harder it is for us to read, the harder it is to evaluate your application. In terms of content, there are many different nursing programs. Why are you applying to this program? And why are you choosing Penn? If you're applying to an APRN program, what interests you about the role? If you're applying to a specific population and acuity level, what interests you about that? How have your experiences prepared you for this program and role? If you're applying to our PhD program or one of our postmaster's DNP programs, we want to see a demonstrated understanding of your research interest or DNP project interest. We don't need to see an outline or research done, anything like that. That's the whole point of the program, but we want to see that you've carefully thought about this research interest and that you have a demonstrated interest. And your career goals and your aspirations. What do you want to do with this degree? We don't need a 5-year plan. Not many of us have one. But again, we want to see that you've thought about what you will do with this degree. We require 3 letters of recommendation. You can submit up to 5. That is purely for your benefit. There are no extra points for submitting more than 3 recommendations. We'd like to see at least 1 academic reference. It is not required. We understand the farther you get away from academia, you may not have a strong academic reference. We like to see an employer, which means a direct supervisor, someone who manages you directly, whoever that may be, and then another professional reference, so someone else who knows you in a different professional capacity. So in general, we are looking for quality, not name recognition or Penn alumni. It is great if you know the dean or CNO or an alumni, but if they can't write a solid recommendation or really talk about all of the great skills that would make you a strong student, a strong NP or midwife or DNP, then that really doesn't help us. Your recommendations should build upon other aspects of your application and can certainly emphasize strengths and weaker parts. So if you're concerned about academics, but you did well in a class, you could have that faculty member write a recommendation. And lastly, we only accept academic or professional references. I am sure your mom or grandmother or uncle or best friend could write a really great recommendation, but that's not what we're looking for here. So only academic or professional recommendations. So as of July 1st of this year, the GRE is no longer required for any program, so you do not have to submit GRE scores. If you are a non-native English speaker, or if your undergraduate degree was not conducted in English, you do need to submit the TOEFL or the IELTS. We do not have a preference, but you do need to submit one, and the minimums are on the screen. For transcripts, we require transcripts from your BSN program and all additional degrees or coursework completed. You can submit unofficial transcripts during the application process, and that is strongly encouraged. You don't need to submit official transcripts unless you are admitted, so save your money and your time. And international transcripts must be evaluated through WES or CGFNS. Other application items, we do need to see an RN or APRN license and just upload whatever you're issued, that's fine. If you're an international applicant and you do not have a United States license, but are licensed to practice in another country, you must complete the CGFNS certification program. We require a statistics class, and that just needs to show up on your transcript. For our postmasters and executive leadership DNP programs, there is a clinical verification form which can be accessed in the application. And the interview process is by invitation only. We will contact you if you get to that next step. Okay, now I'm going to quickly talk about student services that are available at Penn. So as a student, you are not just a student of the nursing school, you are also a University of Pennsylvania student, and you have access to all of the resources at the university. So within the School of Nursing, we have our own Office of Student Services, which offers advising in addition to your faculty advisor that you get, registration, student life, graduation. There's the Office of Career Services, which can be very helpful. You may not have applied for a job in a few years, and after graduation, you'll need to. So they can help with mock interviews, cover letters, resume writing. They put on a lot of career fairs and events throughout the year. There's the Counseling and Psychological Services office, if you need individual counseling, group therapy, other referrals, they're a wonderful resource. The Weingarten Learning Center is a great center. They help with everything under the sun when it comes to academics through the Office of Learning Resources. So maybe you haven't written an essay in a while and you need some help with that, either formatting or citations or just proofreading, tutoring, they can help with. There's also the Student Disability Services housed under there. So if you need any accommodations, they can help with that. Student Health Services offers primary care, but also specialty care, even massages and stress reduction, which is fantastic. And then there's the Graduate Student Center, which is a physical center on campus where you can go and meet up with people, study, access their resources. They put on a lot of events throughout the year, arts and culture, community service, mentoring with other graduate students. And I would be remiss to mention that they do offer free coffee. You just need to bring your own to-go cup. But, you know, as a grad student, free coffee is always important. And now I'll also touch quickly on tuition and financial aid. So tuition fees for all of our programs are available on our website. The very basics are your program costs depend on how many course units you take per semester. The average course at Penn is worth 1 CU and is equal to 4 semester hours. So there's no in-state or out-of-state tuition. There's really no difference in cost between full-time and part-time. A CU is a CU, and you'll see that on the next screen. And if you have any specific questions about financial aid, please email the financial aid office. So these are the tuition and fees for the 21-22 year. The summer rate is a little bit cheaper than the fall and spring rates. If you're planning on going full-time, which is 4 or more CUs in the fall and spring, the estimate is on the screen. That also includes estimates for personal and living expenses. That might not apply for you. You might have less expensive housing, you might have more expensive. The full breakdown is available on our website. We have a few scholarships available. There are need and merit-based awards for our full-time students. We have a new Gutman Leadership Scholars Program available for accelerated and full-time MSN applicants. The president of the university, Dr. Amy Gutman, and her husband donated a few $1,000,000 of their own money to the nursing school, which was incredibly generous of them. So we have a scholarship for our full-time MSN students. We participate in veteran and GI benefits, so the Yellow Ribbon and post 9/11 funding. We have a fellowship for returned Peace Corps volunteers. If anyone here is a Penn Medicine or Children's Hospital of Philadelphia employee, we have a scholarship program where on top of any benefits you receive through Penn Medicine or CHOP, after you complete 3 course units in 1 calendar year, you can get a scholarship for the cost of the 4th CU in that same calendar year. So basically, if you take 4 CUs from January to December, 1 cost of tuition will be free, which is great on top of the other benefits that you receive. Additional funding opportunities. Many of our students take out loans. Some take out Grad Plus loans, federal loans, private loans. It really depends on your situation. I encourage you to look into all possibilities available. There are several federal loan repayment programs. You may have heard of the Public Service Loan Forgiveness Program, but there are health care and nursing specific loan repayment programs as well. There are also external scholarships. We have a list on our website, but also explore on your own. You would be surprised what you could get an external scholarship for, and those can really add up, and that is just free money. You don't have to repay to anyone. Okay, now let's talk about application deadlines. So our MSN part-time spring deadline has passed. That was October 15th. I keep it on here because our deadlines usually don't change. So if you're interested in enrolling next year for part-time spring, so spring 2023, the deadline would be on or around October 15th. If you're interested in applying for MSN for full-time, the deadline is November 1st, which is in a week. And if you're interested in applying for our MSN programs for part-time summer or fall, you have plenty of time to apply. The deadline is not until March 15th, 2022. So our MSN programs, we have specific deadlines, but we have a rolling review process. So that means you might hear back 2 weeks after submitting your application. You might not hear back for 3 or 4 months after submitting your application, depending on when you submit. So for our part-time spring, the latest you'll hear back is mid-December. For full-time summer, the latest you'll hear back is mid-February. For full-time fall, the latest you'll hear back is mid-March. For part-time summer and part-time fall, we typically don't start reviewing until after the new year. So part-time summer, the latest you'll hear back is late April. Part-time fall, the latest you'll hear back is mid-May. Our other programs follow a more traditional review process. So the nurse anesthesia DNP program, remember that's for 2023. The deadline is also in a week on November 1st. You'll hear back in late April. Our postmasters and executive leadership DNP programs, deadline is November 1st. You'll hear back in mid-February. And the PhD program deadline is December 1st, and you'll also hear back in mid-February. And we don't have too many upcoming events since most of our deadlines are here. We do have 2 specific PhD program webinars coming up in November. And we also have previously recorded webinars on all of our programs on our website. Okay, now I will take questions. So if you want to type your question in the chat box, I will do my best to answer. And again, any super specific questions, send us an email. And if we don't get to your questions, you can also send us an email. So I will take a breather while you all ask questions in the chat box. Is work experience required for the midwifery program? No, again, work experience is not required for the midwifery program or any of our primary care programs. What are the requirements for the PhD program? I'm not exactly sure what you mean. I did go over the application requirements. So if there's something specific you're asking about, just clarify in the chat. Is the PhD program full-time only? You can request to go part-time. You would need to explain that in your application. Very few people go part-time, and it's usually Penn staff members. When would the interview invites, oops, people are typing. When would the interview invites when are they sent out for the anesthesia program? The interview invites for the anesthesia program will start in mid-December, and invitations may go through as late as February. Is there a difference in job opportunities between the 2 leadership admin master's programs? Not really. You could certainly pursue the same sort of career with either program. It kind of depends what your interests are in the curriculum. Some people are interested in exploring other Penn classes. The health leadership program lends itself nicely to one of our dual degrees with the MPH or Master in Law program. Other people are really interested in that practicum, so they go for the admin. Can you switch between part-time and full-time once accepted into a particular program? Potentially, we can't guarantee that because clinicals are guaranteed for every student. We may not necessarily have a clinical spot for the cohort you want to switch into, but you can certainly request. Oh, yes, thank you. I received an email stating the deadline for the Executive Leadership DNP program has been extended to December 1st. Yes, so for the Executive Leadership DNP program only, the deadline has been extended to December 1st. Can you go over the references again? So we'd like to see at least one academic reference. We do understand the farther away you get from academia, you may not have a strong academic reference, and that's okay. An employer, so direct supervisor, and then someone else who knows you in a different professional capacity. So that can be a former employer or supervisor or someone else you've worked with. Is there a scholarship for the PhD program? So full-time students are fully funded for the first 4 years. How do we get access to today's webinar? It will be emailed to you in a few days. I'm almost finished with the statistics course prerequisite. Can I send in the transcript after the deadline? Yes. So what you should do is for any courses you're currently enrolled in, upload proof of enrollment so you can submit the application. And then when the grade comes in, you can send an updated transcript. I'm applying to the psych mental health program for summer 2022. I know the deadline is next Monday, so not all applications are in, but is it looking very competitive for this term? What is the usual acceptance rate? It's always competitive for every term. I can't really comment if this is more or less competitive than any other year. For MSN programs, the acceptance rate is around 30 to 40% across all of our programs. How many days a week are you in the classroom and clinical for part-time? It depends how many courses you're taking. Our courses are typically offered once a week. So if you're taking 1 or 2 courses, you're usually in the classroom 1 or 2 days. Clinical is usually 2 days a week, 8 hours a day. How full-time are the full-time MSN programs? I'm not exactly sure what you mean. You're usually taking, if you're full-time, around 4 courses a semester, if that answers your question. For the PhD program, I tried to contact one of your faculty members, but didn't get a reply. Do I need to contact again or find another faculty? I recommend contacting multiple faculty just so you're talking to more people, but you should also try reaching out again. For the PhD teaching or research residency, is the stipend truly livable for a small family with no other income? Or is it possible to work as a part-time APRN while completing the program? Good question. It is a small stipend and students either usually do work part-time. I believe you can work up to 10 hours a week, or they do take out loans to supplement what they receive with their stipend. For the CRNA program, are clinicals in the same sites as the NP program? Yes, so clinicals are in Pennsylvania, New Jersey, and Delaware. There are a few clinicals just for the CRNA program in Baltimore, and there is a specific student apartment for that program since that is pretty far. Will the CRNA program interviews be virtual or in person this year? We are still working that out, so stay tuned. Are all PhD courses held during the daytime? Yes. Our interview, already answered that, so we're still working out if CRNA interviews will be in person or just virtual. For CRNA interviews, you'll hear back as early as mid-December and could go through February. Do we have to submit UPenn transcripts if we've gone through a UPenn program? So we do ask that you upload unofficial transcripts as part of the application process. If you're admitted, we can get those official transcripts. Is there a max number of students accepted for DNP and PhD? DNP, we typically like to admit around 15 to 20 every year. PhD, it really varies based on our funding. We typically admit 8 to 12 PhD students every year. Do all graduate programs interview applicants? Yes, so all of our programs interview applicants. The specific faculty member will interview for that specific program. Only competitive applicants are invited to interview, so not everyone will be offered an interview. If I took graduate level courses during my undergraduate nursing experience, would the credits transfer, and is there a limit? So we can accept up to 2 graduate level courses. That is not guaranteed, and it's only evaluated after the admissions process. Can I update TOEFL scores after the deadline? No, we do need everything in by the deadline. How many interviews for the CRNA program and how many are given spots for the class? So we interview anywhere from 75 to 90 for the CRNA program and admit around 28 to 30. Will we get a letter of rejection if not offered an interview? Yes, everyone will hear back either way about their application status. In terms of taking the pharm and patho courses as a non-degree student, can those classes be taken online? So due to the pandemic, they have been offered online. I am not sure what the status will be in the coming years. They will probably go back to being in person. So as of right now, I would plan on them being in person in Philadelphia. So for the CRNA program, do you need 2 years of ICU experience to apply? So you need to meet the 2 years of ICU experience by the time you matriculate. So you can apply with 1 year, but do keep in mind our competitive applicants are typically applying with 2 or 3 years at time of application. For the PhD program, do the faculty have to have the same research interest as you? Not necessarily. It's certainly helpful if they have some sort of connection, but obviously they may have something similar, either the method that you want to collect data by or the population, but maybe a different focus. So they don't necessarily have to have the same research interests. Can I apply to the MSN program before taking the statistics prerequisite? You do need to be at least enrolled in a statistics class if you haven't taken one. Can you coordinate a PhD degree with nursing and public health or sociology, i.e. more than one faculty mentors from different programs? Your faculty mentors do have to be within the School of Nursing. Where do I find the UPenn research interests? On our website, if you, there should be a header that says research, and you can explore then by research interest, or just look at all the faculty there. Any other questions? What is the percentage of FNP students that start the program without RN experience? I don't have those statistics. Most of our students have some sort of work experience. We do not admit many people without any RN work experience. As I said earlier, transfer credit is not guaranteed and will only be evaluated after you're offered admission. Does picking up a minor help the full-time application for psych? No, it doesn't help for any program. It's just to gauge interest. You're not tied to that. It doesn't affect your application really in any way other than just to understand if you're interested in a minor. Is the funding different for full-time versus part-time PhD? So part-time PhD students, which again, I do want to stress that there are very few. In fact, the past few years, we have not admitted any part-time PhD students. There is no funding for part-time PhD students. There is only funding for full-time PhD students. How many years of RN experience do psych and P students have before enrolling? So I don't have the breakdown by program, but across all of our programs, typically have around 3 years of work experience. Okay, it looks like the questions are slowing down. So for those of you who have stuck through to the end, thank you for listening in. If anyone has any additional questions, please feel free to send an email to admissions@nursing.upenn.edu. Thank you all for listening in. Good luck with your application, especially if you are applying within the next week. And we look forward to reviewing your applications. Thank you, everyone.